It's a very special time tonight. We all are living in this era of a lot of stories. In the media, sometimes in the media, the hype is a little bit too much. We're trying to separate the hype around the flu tonight with Dr. Akhtar from the virtual hospital system in studio with me. We'll take your calls momentarily. Doctor, the flu shot, this is the bone of contention. Sometimes you can get flu-like symptoms from it. Is that possible? And is that, we were trying to piece out, what's the biggest reason why people like me did not get the flu shot, or even your doctor?
Exactly. So, you know, it's interesting. There's many reasons why most people, and I would say most people who should get their flu shots don't, right? So the vaccination rates are below 50% overall. For young people between 18 and 49, it's less than 30%. It's really remarkable how few people are getting their shots. So the question is, can you get flu-like symptoms from the flu shot? The first thing is, you cannot get flu from the flu shot. Okay. The shot itself is what we call an inactivated vaccine. It's the abbreviation is TIV, trivalent inactivated vaccine. So they actually take flu and they destroy it, and make it into its components. And the injection contains no viable virus at all. There's no way it could infect someone else. People sometimes get local site reactions. That's mostly what we see, pain and swelling on the site of the injection. But the reality is, Dom, we're given a shot at a time where the respiratory virus is circulating. What is the chance of you getting a cold at the same time you get your flu shot, or around the time, and in your mind associating the two of them? So the shot itself cannot pass on influenza. It should really not cause influenza-like symptoms, right? As you know from having had the flu, they're not subtle symptoms. They're really not.
No, not at all.
It's quite severe, right?
And the cost factor, we don't think, because you can go to your primary care physician, or I notice a lot of people are smart, a lot of companies are smart, they're offering free flu shots to draw people in to that place.
In fact, more than a third of patients nowadays are getting influenza vaccinations outside of their primary care office.
Any difference? I would go to my primary care doctor, but is there any difference with?
You know, in someone who's otherwise healthy, no difference. Get it. The important thing is get it. If it's easier for you to get it on your way to your CVS, get it there. Whatever is easier. You know, if you have a more complicated medical history, or you have a question about which vaccination is better for you, or you have any problems with eggs in the past, then you should receive it in a specialized office setting. Now, that's the inactivated shot. The flu mist is another way of giving the vaccination.
The nasal vaccine.
This is the nasal spray, like the Flonase type of spray.
All right, so there's an advantage for people who don't like to take a shot. Is there any potency difference between the two?
It's supposed to be just as effective. However, it is a much smaller range of people. So it's really from people who are up to 49 years old. So from 2 to 49. So older people over 49 cannot get the nasal thing. The caveat about it is that the nasal vaccine is actually a live vaccine, Dom, It's what we call a live attenuated vaccine. So it's a very weak, puny vaccine and can only survive in cold temperatures like your nose. It can't survive in your throat or your lungs, which is where influenza really causes havoc. But that can cause a runny nose and sometimes headaches in kids, and rarely nausea and vomiting.
Let's take another call for the doctor. Let's go to Maurice. Maurice in Mount Laurel, you're next in. Hey, Maurice, good evening. Go right ahead. Maurice, are you there? All right, give us a call back. You can jump in any question you have about the flu, prevention of the flu, related items. Let's talk about your home. Do you have a humidifier? Is that something people should be doing? You know, this common sense, even the vice president said that enclosed environments, hot houses, that's going to breed more germs.
Yeah, I mean, I think you have to be careful when having humidifiers that are not properly cleaned. So I do not have a humidifier, and I have children. I have one of my daughters has asthma, so I think I could maybe symptom-wise benefit from it. But I think it's difficult for me to keep it as clean as I would like to. And it's really not influenza that we think about in those settings, but molds, other easily contaminated things, maybe even some rare infections like Legionella that we think about with standing water. But influenza is not one of the main things with the humidifier.
Any difference between washing? I've been told that washing with soap is better than the sanitizer, but the sanitizer is more portable and easier to use.
Sanitizer is much easier to use, and in reality, for most pathogens, they're equivalent. And it's a big thing there's many studies showing that if physicians or ICU nurses wash their hands as many times as they were supposed to, they would spend their whole day washing their hands. You're supposed to sing happy birthday twice as you're washing your hands.
Right, exactly. That's a lot of birthdays.
I wouldn't sing it. I wouldn't see any patients. I just wash my hands. So the sanitizer actually lets you have appropriate hand hygiene. But again, some exceptions are visually soiled hands should be washed in a sink. And the C. diff spore that we talked about earlier needs hand washing rather than alcohol.
All right, Maurice in Mount Laurel, you're back with us. Go right ahead with your question for the doctor.
Hi, Doctor. It's Maurice Cairoli.
Hey, how are you?
Good. Oncology patients who are receiving chemotherapy, one, is it safe for them to get the flu vaccine? And if it is, when should they get it during the course of chemotherapy? And is the nasal vaccine safe for oncology patients or no?
That's a great question, Maurice. Well, oncology patients should definitely get the influenza vaccination. In fact, they should be moved up to the front of the list if we have a vaccine shortage, like pregnant women, the young and the old. So oncology patients are at increased risk for development of complications from influenza. So they should get it when it becomes first available, like the rest of us, September, October, whenever the influenza vaccination comes out, oncology patients should be getting it as well. In general, the live attenuated or the nasal vaccine is not strongly encouraged for oncology patients. And that's because there is a theoretical risk of them developing influenza even with an attenuated virus. The CDC recommendations really are that you have to be severely immunocompromised. In other words, a leukemia patient with a bone marrow transplant, and not just a simple, but a lung
the
cancer
bottom line
patient.
is it's pretty widespread people to get their flu shot.
Everybody should get it. Everybody should get it. And more importantly, it's the people who are the family members and the caregivers of our oncology patients that we are doing them a disservice by not getting our influenza vaccination.
All right, hear that out there, doctors? The doctor's coming after you if you don't get your flu shot. Coming up, we'll talk more with the doctor and take more of your calls and talk a little bit too with coping with the flu if you somehow or another come in contact with it. All straight ahead on Dom Time.